Anderson. I'm a student at Indiana State University, LPN to BSN degree program, nursing department. This is NURC 444, Community Health Nursing, and I'll be discussing uterine fibroids. Here are the learning objectives. To understand what uterine fibroids are, to bring awareness to uterine fibroids and the prevalence among premenopausal women, to learn about uterine fibroid symptoms and diagnosis, to identify the effect uterine fibroids has on menstrual bleeding and pregnancy, and to discuss all treatment options, their benefits, and their risks. Here is the pretest, 10 questions with 4 multiple choice answers to select from. So, what are uterine fibroids? Here's an ultrasound of a uterus. There are the uterine fibroids. You can see the little bumps, or somewhat circular images there. Uterine fibroids, also known as myomas or leiomyomas, are benign tumors of the smooth muscle of the uterus. They are the most common benign tumors in women of childbearing age. The cause is still unknown. However, hormones such as estrogens and progesterone are believed to be linked to growth. Development rarely occurs before menarche and typically disappears after menopause. Prevalence of uterine fibroids among premenopausal women. So in African American women, 60% by age 35 are diagnosed or identified to have uterine fibroids. This number increases to greater than 80% by age 50. In Caucasian women, 40% are discovered to have uterine fibroids by the age of 35. That number increases to 70% by age 50. Other risk factors apart from race include family history, obesity, and early menarche. How are uterine fibroids identified? Well, they go by signs and symptoms. And those most common symptoms are pelvic pain, heavy, lengthy menstrual cycles, fertility issues, or loss of pregnancy. Typically, uterine fibroids are asymptomatic, so most women won't even know that they have them. And the diagnosis? They're diagnosed bimanually through a bimanual examination during a Pap exam. That is when your physician sticks their fingers into the woman's vagina and palpates around the top part of their pelvis, the lower top part of their pelvis. This is to identify any lumps or masses in that area. And if pain is elicited, that's usually significant for something like a tumor of some sort or any kind of abnormal finding. They can also be diagnosed through transvaginal ultrasound, and that's when the transducer is introduced into the woman's vagina to get a clearer picture of the uterus and ovaries and fallopian tubes. Also, they are diagnosed by magnetic resonance imaging, also known as MRI. that is a good way to look at the soft tissues of the body, and that gives a better view of what's going on in the soft tissues and the muscles, as fibroids are seen in the smooth muscle of the uterus. So how does uterine fibroids affect menstrual bleeding? Abnormal uterine bleeding caused by uterine fibroids is called ovulatory uterine bleeding. This type of bleeding occurs during the normal menstrual cycle with ovulation, but is heavier and lasts 7 days or more. Menstrual bleeding becomes excessive when the pad or tampon needs to be changed every 1 to 2 hours, soaked, and there's passage of clots bigger than 1 inch. And here's a diagram to kind of demonstrate what light bleeding looks like, moderate bleeding, and heavy bleeding, which, as shown, is saturation within 1 hour. Pregnancy. Is pregnancy possible? Yes. Oh, look at the baby in the pregnant belly with the cute shirt. Though it may be difficult, it is not impossible to conceive and carry to term with uterine fibroids. Bleeding and pain are noted primarily in the first trimester. There's not much report of any type of difficulty, pain, or bleeding due to fibroids in the second or third trimester of pregnancy. What are the treatment options? There are non-surgical treatment options, and those are watchful waiting. This is primarily for small asymptomatic uterine fibroids. Weight loss. As it was mentioned before, obesity is one of the traits that can lead to uterine fibroids being diagnosed, and that's because obese women have decreases of estrogen levels in the blood. Another treatment option is to increase the androgen levels, or androgen levels, which are male hormones. The side effects can be increased hair growth, a development of a deep voice, and weight gain. Another non-surgical treatment option are hormonal replacements or hormonal balancing and pain relieving medications, of course due to pelvic pain. Causes, symptoms of menopause, or the hormonal replacements cause symptoms of menopause such as hot flashes, headaches, and vaginal dryness. That is a side effect. But the good thing about non-surgical treatment options are they retain the uterus. However, it is just a temporary solution. So, the other treatment options are surgical. Surgical treatment option is a myomectomy, which is just fibroid removal. This maintains the uterus through restructuring. This maintains the uterus, though restructuring is necessary. It does cause uterine scarring, and there's a 30% chance of regrowth of fibroids. Uterine fibroid embolization. This will block the fibroid supply of blood, which eventually kills the fibroid and stops it from growing. But it can cause other severe vascular side effects to include death. Then there's hysterectomy, which is the most recommended procedure because it permanently eliminates uterine fibroids. However, there are also less complications, but there are lifelong consequences such as infertility. And here's the post-test to answer what uterine fibroids are. The age that uterine fibroids are most prevalent. the age where they're least prevalent, the symptoms, how they're diagnosed, what heavy menstrual bleeding is, how does uterine fibroids affect pregnancy, what non-surgical treatment options there are, and what surgical treatment options there are. And lastly, what is the most recommended treatment? References. Thank you.